The situation in the city is quite appalling. The west side of the city, where a very, very intense war was fought, the city is destroyed. Access to basic services is not there for majority of the people who are back and for those who are planning to come back. Some primary health care clinics are back and working, but the supply of drugs and the salaries of the health workers are not all the time present, so this is making that people don't have enough access to health care today in West Mosul. Since June 2017, when the war was still being fought in West Mosul, MSF opened this hospital in the neighborhood of Nablus because the war had finished, the cases of trauma reduced, and then MSF focused more on mother and child and on the emergency room services. For children, we have a pediatric ward and a newborn care ward. And for women, we have a maternity, we can conduct deliveries, and we can offer also C-sections for the women who need C-sections. We are doing around 400 deliveries per month, and on top of those 400 deliveries, around 100 C-sections were done. So when a woman already had a C-section before, in her next delivery, she's more likely to need a C-section. We try to work that for those that still a natural delivery can be done, that we can offer this natural delivery under safe conditions. If health services are not always available or access is difficult, a woman who is about to deliver is at more risk if she doesn't have a facility where to go and have a C-section. In Iraq, we see that many families do prefer to use infant formula for the young babies. So today, with the conditions in which there's no access to safe water, people don't have jobs yet, they also want to keep giving babies formula, it becomes difficult. We're working a lot with health promotion and trying to together, work with the families so they can understand that, the breast milk of the mother is the best food that the baby can receive. So it is the most adapted food for the babies.